Community Talk on Q104.7, the 805's Hip Hop and R&B. Speaking to Marina, Lisette, Luis, and Isabel from Clinicas del Camino Real, because April is STD or STI Awareness Month. So we're talking about myths. We brought a couple up. Now I have a couple more for you guys. Hopefully you guys can clear this up for us. I haven't been exposed to sexually transmitted diseases because we haven't gone all the way. We usually only kiss and touch each other. Well, we did have oral sex, but only once.
Do you want to answer that one, Isabel?
Okay.
She's a health educator, so she's more equipped to answer that one than me.
When it comes to transmitting an STI from one person to another, that can be through anal sex, oral sex, or vaginal sex. So all those three are some form of sexual contact, and a STI can be passed from one person to another. So most likely if you're going to be responsible enough to be having sex, then you definitely want to take care of yourself too. Whether it's preventing pregnancy, preventing STIs, and just making sure that you're healthy all around.
Okay, another myth. I'm protected from sexually transmitted diseases because I take the pill.
Got another one for me. Okay.
Yeah, we're all looking at you. So.
You're actually more exposed because a person becomes confident, hey, I can't get pregnant, I'm on the pill, so I really don't need to worry about anything. But like I tell all my patients that come in, it only protects you against pregnancy. It doesn't protect you against infections or diseases, so you are exposed.
Okay, and now the only contraceptive that actually does protect you from an STI is a condom, right?
Correct. And
Okay.
even the condom, there's some STIs that it can't protect you from because there's still other skin that can be exposed.
Okay, and those are...
That would most likely be herpes, for example, and that one is caused by a virus, so herpes doesn't have a cure. So no matter what, use a condom. HPV also.
I had a sexually transmitted disease and took most of the medicine the doctor gave me. So I didn't go back for my follow-up appointment because my prescription got rid of the STD.
Follow-up is always important, no matter what, because you want to make sure that the medicine is working. And cost shouldn't be if that's an excuse, it shouldn't be, because there are programs that help cover the cost when it comes to your reproductive health. So follow up when it comes to any kind of STD, pap smears, whatever it is that has to do with your reproductive health, whatever it has to do with any part of your health. Follow up is always really important.
And take all of your medicine that's
exactly the way
right?
that the doctor prescribes it. Yes.
I don't have any signs or symptoms of sexually transmitted diseases, so I can't be infected.
Another one,
Marina?
That's not true, because most of the symptoms go undetected. And so you never know if you have some form of sexually transmitted infection, particularly AIDS. Like Isabel said earlier, you can have the virus, but you may not have AIDS until once your immune system is completely eliminated, and then you become infected with like a regular cold, and then you start to get really sick. So always come into the health center and get tested every 6 months, particularly for HIV. Every 6 months, we like to encourage our patients to come in. It's a very simple test. There's two ways that you can do it. There's a rapid test. It just takes 20 minutes, or there's also a blood test that just takes a week long.
And how much does it cost?
I think it's that for the rapid testing, there's no charge to it, and those are done through the county public health department. And you can do those anonymously. You don't even have to give your name. You just have to go in and just take the test, and then you receive a little bit of counseling on risky behaviors from the person who's administering the test, and that's it. 20 minutes and you're done.
Let's go back to AIDS and HIV. What are some of the signs that might suggest that you have been infected with the virus?
That's the thing with HIV, is there are no symptoms.
Really?
The only way you'll know is if you get tested.
I've only been sexually active with one person, so I don't have to worry about STDs.
I think this is the most silliest myth, simply because you really want to know your partner's sexual history. So even though you've been sexually active and almost exclusively with one person, you don't know for sure if your partner is actually sleeping with other people while sleeping with you, or you don't know who this person has slept with in the past. and whether or not they've had protected sex or unprotected sex. So you have to be careful, get tested, and communicate and have that discussion with your partner.
Especially among men, especially among Latino men, it's kind of a hard or very difficult conversation to carry on with that person, because you can't suggest or ask about past partners or suggest that they go to the hospital or doctor to get checked out. It's almost like an insult.
Yes.
So how do you go about handling such a situation, or how do you bring it up in a conversation?
You know, I think if you're in an intimate relationship with someone, these are very personal, intimate questions, and you should feel free to bring it up with your partner. If you don't feel comfortable bringing these questions up with your partner, or if your partner gets really upset and angry, then I don't think that's a really good relationship for you to be in.
I actually heard a myth, and I thought it was kind of stupid, because I don't know. I've heard that if you're a virgin, if you have sex with somebody that's infected with HIV, that you cannot get it. That is totally stupid, and you can get HIV because, or another infection, and you can, because I mean that person, you're sleeping with them and stuff, so you can get it. So.
And unfortunately, there's probably a lot of people out there that believe that that is true.
Yes. And I think that's why what these kids are doing, what this program is trying to do, is so important, because the more people are educated on this topic, the more right decision, or the decision will be more informed, and they'll be able to say, hey, you know what, this is right, this is wrong, this is what I'm supposed to do, and it'll make them feel even more confident about the decision that they make, because they know they're being well informed about their body, about their sexual health.
Yeah, and then also, you know, recently the CDC, the Center for Disease Control, which is a federal agency, conducted a national youth risk behaviors survey in 2005, and it found that among students, Latino students, between the grades 9 to 12 who are currently sexually active, 42.3% of those Latino students did not use a condom during the first time they had intercourse. So the numbers are really outstanding. So just because, you know, you have your boyfriend is telling you, oh, you know, the only one you're sleeping with, you know, you really want to take ownership of your own body and ownership of your own health. And that's what we really want to make sure that young people, both boys and girls, do as a result of listening to today's show.
Clinicas del Camino Real, that phone number once again, please.
642-6322.
And website?
Clinicas.org. And then we also have a MySpace page, myspace.com/Clinicas del Camino Real, INC.
And these services are open to the community. Now, if someone doesn't have insurance, can they come and see you? Will you help them out as far as insurance goes?
Yes, definitely. We have a sliding fee scale.
Okay.
So if a patient comes in and doesn't qualify for any program at all, which I find very hard to believe, because we will always try and fix them up with some kind of program that'll help them out, there is a sliding fee scale that'll take into consideration what they make and what they can pay, so that they get the services that they need.
And then there's also the Family Pact program, which is a state-funded program that you enroll in, just like with Medi-Cal. It's very easy to enroll in. You just come into the health center, and a front desk person, and you just ask a front desk person that you want to enroll in the Family Pact program. And this helps to cover all of your reproductive health services. So it covers for girls, it covers your annual PAP. For boys, it covers for both boys and girls the STD screenings. It also pays for your contraceptive methods. So every time you come into the health center, whether you choose condoms, the pill, a ring, Family Pact will pay for that.
Okay.
And what's nice about Family Pact is that it's confidential. So you shouldn't be scared that your information is going to be leaked out to your parents, to anybody, because
even if they're under 18?
Even if they're under 18.
Okay.
By law, we cannot share any of their information with anybody. Of course, there are some buts to that.
Okay.
If a patient comes in and tells us that somebody's hurting them, if they tell us that they are hurting somebody else, or if they tell us that they think about hurting themselves, well, of course, we're mandated reporters, so we have to share that with either the provider or with some other kind of authority. But anything else that they have questions about, they shouldn't be embarrassed to come and ask, because we've heard a lot. So we're not embarrassed to share and talk to them, and we want them to have all the information